Did you know that 1 in 20 women will be diagnosed with breast cancer in their lifetime? And 1 in 70 will die from the disease. While these statistics may sound alarming, there's good news. Recent advancements in precision medicine, immunotherapy, and targeted therapies have significantly improved survival rates and quality of life for many patients, even those with advanced stages of breast cancer. The key to better outcomes lies in early detection, awareness of symptoms, and prompt medical attention. When caught early, breast cancer often has a good prognosis, and many patients go on to live healthy, fulfilling lives. In this video, and the upcoming parts of this series, we'll dive deep into everything you need to know about breast cancer. From understanding risk factors and early warning signs to exploring the latest treatment options and preventive measures, we'll equip you with the knowledge to stay informed and proactive. Whether you're looking to protect your health, support a loved one, or simply learn more, this series is here to guide you every step of the way. Let's get started. What is breast cancer and how it develops? Breast cancer doesn't start as a lump. It begins at the microscopic level, with tiny changes in our cells. But what exactly goes wrong? Let's break it down in a simple way. In a healthy body, our cells follow a strict set of rules. They grow, divide, and when their job is done, they die to make room for new cells. This process is tightly controlled by our genes. But in breast cancer, something disrupts this balance. Genetic mutations is the root cause of cancer. It all starts with genetic mutations, changes in the DNA inside a breast cell. These mutations can be inherited like BRCA1 and BRCA2, or they can develop over time due to environmental factors, lifestyle, or just random mistakes in cell division. Uncontrolled cell division. Normally, our cells have checkpoints that tell them when to stop growing, but when these checkpoints fail, the mutated cells start multiplying non-stop, forming a tumor. Escaping natural cell death, apoptosis. Healthy cells have a built-in self-destruct button called apoptosis, but cancer cells find ways to disable this process, making them immortal and allowing them to grow unchecked. Angiogenesis, the tumor's blood supply. As tumors grow, they need oxygen and nutrients, so they send signals to attract blood vessels, a process called angiogenesis. This helps them expand and survive. Invasion and metastasis, the spread of cancer. Eventually, some cancer cells break away, invade surrounding tissues, and enter the bloodstream or lymphatic system. This is how breast cancer spreads to other parts of the body, a process called metastasis. Understanding how breast cancer grows helps doctors design treatments. Chemotherapy attacks rapidly dividing cells, hormone therapy blocks cancer-fueling hormones, and targeted therapies stop the signals that make cancer cells multiply. If we want to cut it short, we can say that the key to beating breast cancer lies in early detection and targeted treatment. Causes and risk factors of breast cancer. Breast cancer is caused by a combination of genetic, hormonal, and environmental factors that lead to uncontrolled cell growth in the breast. While the exact cause can vary from person to person, several key factors increase the risk of developing breast cancer. Genetic mutations, inherited mutations. Some people inherit mutations in genes like BRCA1 and BRCA2, which significantly increase the risk of breast cancer. Acquired mutations. Most breast cancer cases are due to mutations that develop over time, often triggered by environmental or lifestyle factors. Hormonal factors. Estrogen and progesterone. Exposure. These hormones promote breast cell growth. Prolonged exposure due to early menstruation, late menopause, hormone therapy, or pregnancy history can increase cancer risk. Hormone replacement therapy, HRT, used to manage menopause symptoms, HRT can raise the risk of developing breast cancer. Lifestyle and environmental factors. Alcohol consumption. Even moderate alcohol intake increases the risk by affecting estrogen levels. Obesity. Excess fat tissue produces more estrogen, which may fuel cancer growth, especially after menopause. Lack of physical activity. Regular exercise helps regulate hormones and immune function, reducing cancer risk. Radiation exposure. Prior radiation therapy to the chest, e.g., for Hodgkin's lymphoma, increases breast cancer risk. Smoking. Some studies suggest smoking may be linked to a higher risk of breast cancer, particularly in premenopausal women. Family history and genetics. Having a first-degree relative, mother, sister, daughter, with breast cancer increases the risk. However, most breast cancer cases occur in people with no family history, meaning other factors play a major role. Age and gender. Age. The risk of breast cancer increases with age, with most cases diagnosed after age 50. Gender. While men can develop breast cancer, women are at a much higher risk due to hormonal differences. Dense breast tissue. Women with dense breast tissue, more glandular and connective tissue than fat, have a higher risk because dense tissue can make it harder to detect tumors on a mammogram, weakened immune system, and chronic inflammation. Conditions that weaken the immune system or cause chronic inflammation may contribute to cancer development. Symptoms and signs of breast cancer. Breast cancer symptoms can vary from person to person, and some people may not notice any signs in the early stages. That's why regular screening is crucial. Here are the most common symptoms. 1. Breast lump or thickening. The most common sign is a lump or thickened area in the breast or underarm. Not all lumps are cancerous, but any new lump should be checked by a doctor. 2. Changes in breast size or shape. One breast may become noticeably larger or change in shape. Swelling in part of the breast, even if there's no lump, can be a sign. 3. Skin changes. Dimpling or puckering. The skin may look like an orange peel, pot orange. Redness or scaling. The skin may appear irritated, thickened, or scaly. 4. Nipple changes. Inverted nipple, a sudden pulling inward of the nipple. Discharge, unusual fluid from the nipple, clear, bloody, or yellowish. 5. Breast or nipple pain. Persistent pain in the breast or nipple that doesn't go away. While breast cancer is often painless, some types can cause discomfort. 6. Swollen lymph nodes. Enlarged lymph nodes in the armpit or collarbone area may indicate that cancer has spread. 7. Unexplained weight loss and fatigue. Advanced breast cancer can cause significant weight loss and ongoing tiredness. Early detection can save lives. If you notice any of these symptoms, don't panic, but don't ignore them either. See a doctor, get screened, and take charge of your health. If this video was helpful, make sure to like, subscribe, and share to help spread awareness. Breast cancer screening guidelines. Breast cancer is most treatable when caught early, but how often should you get screened? Let's see what the latest breast cancer screening guidelines say so you can stay informed and take charge of your health. Breast cancer often starts silently, without any noticeable symptoms. That's why regular screenings like mammograms and clinical exams are crucial. They can detect cancer early when treatment is most effective. Screening guidelines for women at average risk. If you don't have a family history of breast cancer or known genetic risk factors, here's what experts recommend. Ages 20 to 39.
Perform monthly breast self-exams to stay familiar with your normal breast texture. Get a clinical breast exam every 1 to 3 years during your routine checkup. Ages 40 to 49. Annual or biennial mammograms every 1 to 2 years, depending on your doctor's advice and personal preference.
Ages 50 to 74. Mammograms every 1 to 2 years are strongly recommended as breast cancer risk increases with age. Ages 75 and older. Continue screenings based on your overall health and doctor's guidance. Screening guidelines for high-risk individuals. If you have a strong family history of breast cancer, carry BRCA1 or BRCA2 gene mutations, or had chest radiation therapy in the past, you may need more frequent screenings. Here's what's recommended. Mammograms every year starting at age 30 to 40, depending on your risk level. Breast MRI in addition to a mammogram, as MRIs can detect cancers that mammograms might miss. Genetic testing and counseling if you have multiple close relatives with breast cancer. Do men need breast cancer screening? Yes, although breast cancer in men is rare, those with a family history or genetic mutations should talk to their doctor about screenings, especially if they notice any breast changes. Remember, screening guidelines are just recommendations. Always talk to your doctor to determine what's best for you. How breast cancer is diagnosed, step by step. Breast cancer starts at the microscopic level, and the only way to confirm it is through proper diagnosis. But what actually happens when you go for a breast cancer checkup? In this video, we'll walk you through the step-by-step process of diagnosing breast cancer, from the first exam to advanced testing. Clinical breast exam, CBE. The first step. The diagnostic journey usually begins with a clinical breast exam, where a doctor or nurse carefully checks your breasts and underarms for lumps, skin changes, or any unusual signs. If something seems abnormal, the next step is imaging tests. Imaging tests, looking inside the breast. Imaging tests help doctors see what's happening inside the breast without surgery. The most common ones are mammogram, X-ray of the breast. A mammogram is the most common screening tool. It uses low-dose X-rays to detect abnormal masses or tiny calcium deposits called microcalcifications, which can be early signs of cancer. If a mammogram shows something suspicious, further tests are needed. Ultrasound. Is it a cyst or a tumor? A breast ultrasound is often used when a mammogram detects an abnormality. It helps determine whether a lump is solid, potential tumor, or fluid-filled, likely a harmless cyst. MRI. A closer. Look at high-risk cases for individuals at high risk or when mammograms and ultrasounds aren't enough. A breast MRI is used. This test provides a highly detailed image of the breast tissues. Biopsy, the only way to confirm cancer. If imaging tests suggest something suspicious, the next and most crucial step is a biopsy. A biopsy involves removing a small tissue sample from the suspicious area and analyzing it in a lab. Types of biopsies. Fine needle aspiration, FNA, uses a thin needle to withdraw fluid or tissue. Core needle biopsy uses a thicker needle to collect a larger tissue sample for more accurate results. Surgical biopsy. If necessary, a part or all of the suspicious lump is removed for analysis. Biopsies confirm whether a lump is cancerous and provide details about its type and characteristics. Lab testing, understanding the cancer. Once a biopsy confirms breast cancer, doctors perform additional tests to understand the cancer's behavior and determine the best treatment plan. Hormone receptor test, ER/PR test. This test checks if the cancer cells have estrogen, ER, or progesterone, PR receptors. If the cancer is hormone positive, treatments like hormone therapy can be effective. HER2 testing, Some breast cancers have high levels of a protein called HER2, which makes them grow faster. If the cancer is HER2 positive, targeted therapies like trastuzumab, Herceptin can be used. Genetic testing. For some patients, genetic testing helps determine if inherited mutations are present, which may influence treatment and family risk factors. Staging tests. Has the cancer spread? If breast cancer is confirmed, the next step is staging, which helps doctors understand how far the cancer has spread. This guides treatment decisions. Common staging tests. Lymph node biopsy checks if cancer has spread to nearby lymph nodes. CT scan or PET scan looks for cancer spread to the lungs, liver, or bones. Bone scan detects if cancer has spread to the bones. Breast cancer is staged from 0 to 4, with stage 0 being non-invasive and stage 4 meaning the cancer has spread to distant organs. Why early diagnosis is life-saving. The earlier breast cancer is detected, the more treatment options are available, and the higher the chances of survival. This is why regular screenings and paying attention to warning signs are so important. Breast cancer diagnosis may sound overwhelming, but each step is designed to ensure the most accurate results and the best treatment plan. Subscribe and stay tuned for the upcoming parts to know about treatments, prognosis, and more.